Hi, my name is Dr. Derek Bingy with Fit Chiropractic and Sport Therapy. I'm going to talk today about some neck tension and shoulder complex that get involved when you have problems with your neck. Whiplash, injuries, fractures, nerve compression. Often we get tight muscles, our head starts to roll forward, it's hard to rotate, hard to shoulder check to get that rotation, and the shoulders come up, either one side or the other or both. So, looking at the anatomy, we have to start with all the muscle groups that stabilize the neck and control motion. So, I always like to start laterally. These are called the scalene muscles. They go from the base of the head, behind the ear, all the way down through the neck, under the collarbone to the first and second rib. And a lot of what they control is a little bit of motions here and there, lateral flexion, but really what their job is to do is accessory breathing muscles. They help lift the rib cage and relax it. The problem with these muscles is they're on top of the nerves that run into the arm. So any sort of extra compression on the muscle creates a referral pattern down the arm. So we have to first go in and double check where these muscles and how tight they are. If they're sensitive anywhere through the muscle group, we know that we have to do some work on them. The first way to stretch them is lateral flexion. The muscles help with breathing by lifting up the rib cage, so we use that to help relax the muscles. So, for example, if I'm going to stretch the left side, I would breathe in and then breathe out and stretch to the lateral side. Keep that shoulder down and hang out at the bottom for a couple seconds. Go back again, breathe in, stretch a little bit farther, hanging out at that bottom end. The other way to get a muscle to let go is by doing pressure points or trigger point work. So you find that muscle, it's tucked under the collarbone. You'll feel them because they're like guitar strings often when they're tight. Oh, right there. Yeah, and I find that pressure point and hold on to it. For 15 to 20 seconds, a lot of pressure. Take the pressure off, find another spot. You'll often feel the muscle melt away as you put the pressure on. It might take 20 seconds though to fully get it to let go. Next spot, all the way up. If you're compressing on a spot and you're feeling or shooting pain down your arm, you're on the nerve, so move off the nerve. Even just half a centimeter away, you'll get the muscle to let go. And always work both sides. The second muscle group that I like to look at with the neck stabilizers are the suboccipital muscles. These are these tiny little, three little muscles that attach to the base of the head that control fine motion, rotation, and a little bit of flexion and extension. So, really, they're little muscles that go from the skull to the first vertebrae, from the first vertebrae to the second vertebrae, and from the second vertebrae back up to the skull to create a triangle. And there is a little nerve that runs down through the middle of that triangle that innervates through the forehead and into the temple region behind the eyes. So sometimes people can get headaches into the forehead. So a way to stretch those, hands together, you're doing a little traction on the very top, and just trying to gap that first joint just a little bit. Sometimes even rotating a little bit, hanging on it, turn it the other way, hanging on it. And again, 30 seconds to 2 minutes, a long time you can hold that stretch for. The other way to get these muscles to let go is using a trigger point work. So either a hard ball or your knuckle. So right at the base of the skull, you'll find a very sensitive spot, and you just try to put as much pressure as you can handle for 20 seconds, a long time to hang out there. The other way is using the ball against the wall. Find that spot, super sensitive, and put pressure into it, 20 or 30 seconds. Take the pressure off, find another spot, put more pressure on. The other way to do it is laying on the ground, putting it on a wall, on a pillow or a bed or a yoga mat to try to get some pressure points on it, and always do both sides. This third component of the neck and shoulder complex is the shoulder stabilizer muscle called the levator scapula muscle. Lifts the shoulder blade. So oftentimes your neck is tight, so your brain says, okay, let's help by lifting the shoulder using the neck muscle. So you start lifting incorrectly. So we really want to keep the shoulders back and down. So put your shoulder blades in your back pocket. And so when you lift your arms stay down until you get to 90 degrees. Then the shoulder can raise up. You never want it to initiate that motion first with the shoulder complex before the arm moves up. So keep that shoulder blade back and down and lift the proper way. So the muscle that does that, we can get it to let go by stretching it. First one is the shoulder's always going to rise up. So we got to keep that shoulder down. So tether it down by holding onto the chair you're sitting on. You grab the top of your head, and if it's on the left side, you would look 45 degrees to the left, grab the top of your head, and pull it down and away. Kind of opposite direction, 45 degrees from that shoulder. Hanging on it for 30 seconds to 2 minutes. And always do both sides. Turn, stretch, down and away. Good. The other way to give that muscle to let go is a trigger point work. So using a little hook or an old cane or somebody's pressure point right at the very top of the shoulder blade where the shoulder blade muscles meet the base of the head. You're going to do a little bit of trigger point. Find those tender muscles and just hold that pressure point for 20 or 30 seconds till it starts to let go, and then find another spot. Move up. Good luck. Give us a call if you need any help.